This video is to teach you how to set up your CADD Soleus pump for TPN. And as you can see here, our TPN bag has already been spiked. Our tubing is attached to the TPN bag. We are going to use gravity to prime the tubing. As you can see, there's still air in the line, and you don't want to connect that to the patient or to yourself if you're doing your own TPN. We're going to put the end, which is still protected by the cap, into the previously sterile bag to collect some fluids later on after priming, and to use gravity to prime. I would suggest hold this part up like this with the blue tab facing down. We're gonna use gravity to let the fluid run. As you can see there, there's some bubbles coming out. Once you pass that and get to the filter, try to put the arrow up like this as well, so that when you're pushing or priming the fluid into the tubing, it will push the air out. And as you know, air rises, so you always want that to be upright. So there you go. We're almost there. I would say maybe prime that until you're closer to the end of the tubing. It's almost out there. As you can see, there's air being pushed out, and the higher you lift the bag, the faster it will flow. So, and then you can see it's almost at the line there. Okay, so at this time I'm gonna just put this down, and what we're going to do is open the latch, and we're gonna attach this piece under here. So what we're gonna do is remove this blue tab, and you should see an area here where you can put the hooks. So you're gonna do that and push to lock it and put the latch back up. On the side, there's a on button right here. So you give it a good push. And you will see it will start on the main screen. And our pump that we provide to our patients are already pre-programmed. So this is showing you what to do when your pump has been pre-programmed. So you're gonna go and press task. You are gonna go and prime the tubing first, because right now we have a lot of air. So we're gonna go scroll down, prime tubing, click select. There's a code of 99, so you're gonna scroll down. 997 is the code, and then you click select all the time. And then here it tells you to disconnect the tubing from the patient, open clamps, then press prime. So we're gonna press prime. Now another thing that the manufacturer will tell you is to put the pump sideways like this, just so, as I mentioned earlier, the air rises. So you want the air to actually get pushed up because the sensor is right here. So you might wanna put this down on your table sideways like this, or you can hold it during priming. And because we already pre-primed it earlier, you can see that maybe there's a little bit of air there right now that's being pushed remaining. Just wait for that to go there. Now, if you didn't pre-prime the tubing earlier, this will prime up to 20 milliliters and then stop and ask if you want to prime again. If you pre-primed and we see that there's no more air bubbles here, you're pretty happy with it, you can actually stop priming. It will ask you continue priming, no or yes, so we don't have to at this time. Now air is all out. Now we're just gonna go to the delivery setting, which is we scroll down and select, and this is basically double checking that the setting is correct. So your rate that your nurse or your TPN team said ordered you, make sure it's the correct one. KVO rate is just to keep the vein open, so normally we don't really put anything there. Reservoir volume is the TPN volume, so the whole TPN bag, that should be the number that they provide you as well. If this is correct, then you click stop start. And it asks you, do you want to start the pump? No or yes. So this is the time if you're ready, you prepared your central line and you're ready to connect your tubing, and click start, basically, right there. And then it will show you that your reservoir is over 12. This one is not set as 12 hours, but it's set at like 13 hours, but it will show based on the rate and the volume that they put in there. It will show you your number of infusion. So that's the preset pump setup for CADD pump.